This is what his breathing treatments look like every day. His vest, which shakes his lungs to loosen the mucus, and then his nebulizer and pump to give him the medication that he inhales. And each medication takes about 10 to 15 minutes, depending on which medicine it is and how much is in the vial. So if he does his 3 full medications, albuterol, pulmazine, and hypertonic saline, that'll take at least 30 minutes. Sometimes the nebulizers don't do the medication as fast, but sometimes it doesn't. Sometimes it's not at the right angle, so it stops on the kit, so the medication doesn't come out as fast. You have to readjust to make sure that it's still smoking. Hold it out and show them. So it turns the liquid into an aerosol. Put that back on the face. There you go. Say something, Brady. What does it feel like to have that vest on? It feels like a bunch of little people punching on your chest. Makes you talk funny too. And the whole point of the vest is to get him to cough. Okay, these are all the medications that Brady has to do during the day. In the morning, when he does his breathing treatment, he'll use the nebulizer kit, and he'll either do albuterol or Xopenex puffer. I prefer to do the Xopenex puffer in the morning with him instead of the albuterol, just because it is in the morning before school and time is a factor. He has to get up a little bit earlier to finish all of his medicine. So if we do the albuterol, that adds time onto the breathing treatment. So usually we'll just do the Xopenex puffer. And then he'll have to do a hypertonic saline, and then he does 2 puffs of, what is this, Symbicort, because he has developed asthma as well as CF. In the evenings, his evening breathing treatment is albuterol, saline, and then pulmazine. And alternating months, he uses an extra nebulizer. This is a special nebulizer for an inhaled antibiotic called Caistin, and only Caistin can be used in this. And this is the only thing that will work for the Caistin. This is the expensive drug. So he's on this every other month because of the Burkholderia cepacia.
How often?
He does this 3 times a day. Right after his morning treatment, he has an extra treatment added in the afternoon, and then in the evening he has to do it as well after all of his other medications. And then he uses this to rinse out his nose. It's a sinus rinse. He also has to use a sinus rinse where he squirts this up in the solution up into his nose to get all the mucus out if he's congested in his nose. Okay, all the oral medications because of his digestive issues. This is Prevacid. He takes these 30 minutes before he eats breakfast in the morning on an empty stomach. Then this is Ursidile. He has to take this because of his liver. He has a mildly fatty liver, and every time they draw blood, his liver enzymes are a little off. This is ranitidine. It is an antacid to help with the reflux as well as the Prevacid. These are his Creon pills. He takes 3 with every meal. So this would be what he does it in the morning at breakfast. These are 3 more Creon for lunch. And then this is what he takes at dinner, another ranitidine and another Ursidile. More Creon to help him digest his food. This is Aquadex. It is a vitamin with higher, I guess it's higher doses of A, D, E, and K. Flintstone's multivitamin with iron because he needs iron. This is Singulair to help with allergies, to keep the pollen and all that under control in his body, I guess, in his nose. He gets allergies, seasonal allergies, and we just keep him on this just to keep the mucus from building up. This is a vitamin D pill because his vitamin D levels are low, and that affects his liver. So we keep the vitamin D up. And this is another allergy pill, Zyrtec, again to help with any building mucus due to allergens in the air. Extra Creon, he takes 2 at every snack. Every time he eats anything, even if he's going to eat just a cookie, he needs to take 2 Creon. The only time that he can get away with not taking Creon is if he's eating something like fruit snacks, anything pectin based. Fresh fruits, fresh vegetables are okay to eat without Creon, but anytime you introduce fat into the food, meat, dairy, any kind of grains, he has to have the Creon to help him digest his food. Typical day.